Welcome to Breakthrough Results by LeadingResponse. Each episode will feature a LeadingResponse host and their guest, discussing tips and tricks on how they achieve breakthrough results. This is a place to learn how to grow your business from people just like you.
Hi, everybody. Thank you so much for joining us. I am Jen DeBuhr. I'm the Director of Sales with LeadingResponse. Particularly, I work in our Medicare division quite a bit and growing our Medicare division. And one of the things at LeadingResponse that we want to do is help share success stories of successful agents that are leading the way in seminar marketing. And so I asked my good friend Tabitha to join us to just share some of her stories, how she got into the business, how things have been going for her this past year, and to tell us some of her secrets because she's doing a wonderful job with seminars. So I met Tabitha earlier this year, this past year. She had just changed over. She had been with a captive agency for 8 years and was moving into the independent space. And she was on I believe on a Facebook chat where a long-term client of mine had recommended that she reach out to me. And so she was interested in doing seminars and reached out to me, and I learned a lot about Tabitha. She has, like I said, been in the Medicare business for 8 years, and she also owns a senior advocacy group called Bringing Back the Village. That's right? Bringing Back the Village. So Tabitha, tell me a little bit about your background. I know you've got a really interesting story about how you found your way into Medicare in the first place and how this all came to be.
Okay. Yeah, I mean, I'm like the million other people in the world. I don't think anyone wakes up is like, I want to be an insurance agent. So, I was actually getting ready to go to grad school. My degree is in international affairs and international economics. And I had big dreams of saving the world through humanitarian programs and community group programs. And my daughter was 8 years old and she became really, really sick with a brain infection. And my entire life just stopped immediately. I had to drop out of grad school. I really even had to leave the workforce. I mean, she just needed constant care. And I had no idea what I was going to do with the rest of my life. And I had a friend who owned an insurance company, and he gave me the opportunity to work from home doing health insurance. And because I was going through so much with my daughter, I mean, I never would have thought that I would find my passion in insurance. But as I was helping my daughter for the first time, it's crisis mode for me, right?
Sure.
I had never had to learn about networks before, prior approvals before, how to schedule appointments. And because I was going through everything with my daughter at the same time as I was being introduced to the world of insurance, I found that I had such a passion of slowing down the process and really helping people in times of crisis or to prevent crisis in order to really help them understand their benefits, help them have more patience through the process. And as I was going through that, it just totally changed the way that I wanted to build a business in insurance. I really wanted to focus on the people aspect of it.
And helping to take care of people. You found this humanitarian love in a way you didn't expect.
Not at all. I mean, I really realized I didn't have to go to a different country to change people's lives. I mean, that was something I could do in my own community. And it was such a blessing to be able to live my passion here in my own community.
And this advocacy group that you started, Bringing Back the Village, was that still part of while you were working with the other agency that you started that?
Yeah, so that came about in a couple different ways. So I kept finding all of these seniors that were in crisis moments. And for me, I just thought this is so easy to avoid these crisis moments. why are people finding themselves in the crisis moment? And then as I was living through it with my daughter, I realized, yeah, and I really realized it was a combination of just people not being prepared, people not knowing that these things, that there were these holes in insurance. And then that everything's become so specialized, there's not that network for even for the professionals to network together to help clients. So when I was stuck at home, I had a hard time working. What I did have was Facebook. And I just started connecting with different groups, asking like, hey, if I have a patient that needs this or I have a client that needs this, how can we help them together? And out of that, we built this community. We have about 40 different professionals that are within the group now. And we teach small communities how they can be a better community for seniors. So we're bringing back that village aspect of, because we say all the time, it takes a village to raise a child.
Yeah.
That village is supposed to be there as we age, and it's just been completely decimated. And so what our group is trying to do is really bring that village aspect back to seniors.
Takes a village to help the seniors too.
Yes, absolutely.
How beautiful is that? So last year, you decided to change. You had been part of a captive agency and you decided to go independent on your own.
Mm-hmm.
And I assume that that was a big, scary decision for you.
Yes.
Tell me a little bit about that decision that you made and why you decided to do that.
Okay. Yeah. So for me, I felt like as I was pulling people in and I was helping seniors, it was just really important that I own that. That was done by me. The way that I was doing, I wanted to be in charge of the entire process and not have another company ultimately tell me how I could treat my clients. So that was the main motivator behind going independent was I just wanted to change the way my clients were treated. I wanted to give so much more specialization to them and like really one-on-one client help. So that was the main motivator behind going independent. And yeah, it was really scary.
Because you were already very successful in your career at this point in time. And so,
Yeah. So jumping away from everything I had known in the insurance business and then saying, I can do all of this on my own and still grow. And it was a lot to take on, but I'm thankful every day. I just found amazing people, again, in Facebook support groups where I found you. It's amazing to me how many people really want to help other agents and want to help people grow this business. And I just felt that the support was out there and I was ready to do it.
so I think that if I remember this correctly, it had only been maybe a month or so that you had been independent. It was early. And in that time, you had sent something on one of these Facebook chats, and one of my old clients had said to you, reach out to Jen and gave you my contact information.
Yes.
And I've worked with her for many, many years and done seminars. And you called me and you were like, I want to do seminars. So what was it where you decided that seminars were going to help you drive this next phase of your new chapter of your practice?
Well, I already had such a big background of seminars from Bringing Back the Village. So what we do through Bringing Back the Village is we do free workshops and seminars. So I was already used to public speaking. I already knew how to work with an audience, and I really wanted to bring that into my business. Again, from a business point of view, if you can stand in the same amount of time as you can do one-on-one with clients, you can get in front of a crowd of 50, 100 or more, and you can share what you have to offer, kind of pre-qualify potential clients, make sure that you're a good fit, and then move forward. And for you to go through, say 100 people on a one-on-one basis, that's weeks if you're going to do that individually. And being able to stand in front of them and do it in 2 hours it's just more time efficient, and it's just a better way of reaching out to people.
So tell me a little bit about the very first one we did. These have been successful for you from the very beginning.
Yes.
I'd love to hear some of the success stories that you have. And I'd love to hear, so this first one happened. How did you feel that very first one as you're walking in? And
Okay, so, I'll tell you the one thing that really surprised me was one of the things that I heard over and over again was when you have these overbook the rooms because people don't come. I had the exact opposite issue. Every single one of mine, more people came than actually RSVP'd. So the first one, I had the chair set up. I was ready to go. I had everyone's information, and just more people kept coming in, and I had to keep pulling more chairs out. And once we started going, it was really surprising to me because I thought it was going to be more of I was going to have to convince them to talk to me. I had to convince them to do business. And they were just so excited that there was someone explaining how Medicare works to them in a relaxed setting, a non-confrontational setting, that they engaged the entire time. They asked questions. I'm from a small community, so it was pretty interesting too, because people knew each other in the room. And so there, at every single one, this has happened so far, someone will say, actually, Tabitha is an agent of my friend, and we'll give the name and say, so that's why we came too, because we had heard about her. And when you have those small communities, it just really builds off of each other and gives you instant credibility in that aspect also.
yeah, that's lovely.
Yeah.
I hear time and time again with these turning 65 seminars in particular that we do, and the Medicare seminars in particular that we do, that there is such a need for education out there, right? That this is someone onboarding onto Medicare is one of the greatest decisions that they're going to make in their entire lives. And there's very little unbiased information for them to find. So they go to these seminars, and not just from you, but from many of my other clients. They tell me all the time, they walk in excited and grateful. And the first thing they say through the door is, thank you so much for inviting me. I'm happy to be here. I need to learn. That's the experience that they have.
100% the experience that I've had so far. I haven't had a single person say that they didn't get something from it. Everyone that comes, either they book an appointment or they refer someone. And so because it's my first year in the industry, I actually haven't done any other marketing at all except for these seminars. And I was really surprised about how many people have booked appointments with me. And I've asked them, well, how did you hear about us? And they said, oh, I got an invite for a seminar that you did at such and such restaurant, and I couldn't make it that night. So I just searched you up on Facebook. I saw what you had to offer. And so I decided to come one-on-one. And that's amazing to me that you can kind of kill two birds with one.
That is amazing. Freezing up for just a second. So hopefully you're back.
There we go.
So what are some secrets that you would share that have been key to your success? And what are some success stories that you would tell to others about your seminar experience so far?
All right. So one thing I've learned that I think a lot of people, when they try to do the seminars, they think it's about Medicare. Like they focus too much on Medicare, too much on the details. They're trying to prove themselves as the experts. I would argue that they're coming to the seminar to see who could help them, not necessarily to learn about Medicare. So you are going to teach them about Medicare, but you're more teaching them what it's like to work with you. What kind of person are you? What kind of customer service are you going to offer them? What's the atmosphere going to be like? Because there's a million places that they can learn about Medicare with, but they're looking for someone that they can trust, someone that's going to make the process easy on them, someone that's going to make them feel that they're in good hands, that if something goes wrong, you're going to be there to help. So I think you have to really focus on don't try to shove the entire meeting about Medicare. Explain how it works, but really explain how you work, what it's like setting down with you, what it's like being in your community of clients. I think that's really important, and that's what a lot of people mess up on when they're doing these. They try to be too professional, too educational, and they're not letting their individual personalities kind of shine.
I am such a big believer in that. One of the things that's happened over the last few years, really as a result of COVID and then all of us going virtual and we all got into each other's living rooms. We're in your living room right now, right?
Yes. Yeah.
And we got to know each other on this much more human level.
Mm-hmm.
And I love that. And I support it. And I tell people all the time, be human. Let those consumers at your seminar know who you are. And it's more important that they know who you are than even what you know. That it's important that they know that you are very much an expert in your field. Let's make that clear. But your humanity and your authenticity is just as important, if not more so.
Yeah, because I think if you're just teaching about Medicare, if you're teaching the same thing that someone can Google and look, then when it comes time to sign up, well, you're just like any other insurance agency. You've already given them the information. You didn't make anything special about yourself. So they're not going to give as much incentive to go with your business because you just did Medicare. But if you show them why you're different and they want to belong in your community with your business, then they are going to seek you out when it's time. And I think that's one of the things that's made us the most successful from this is we show what the family of being with us is like. And yes, you are 100% going to get your Medicare taken care of. You are going to be safe. You're going to get on the right plan, but you're also going to belong to a family that will help support you.
I love that. So tell me a little bit about your toughest seminar. I heard that you had one where some of your attendees were giving you a hard time. Heard a story. And that it actually probably became your most successful event. Will you share that story with us?
Yeah, this is funny. So there's a few tips people can gain from this. So this is one of my early seminars that I did. And so I was booking it in a city that's about an hour away from me because that's something we'll probably talk about. I live in a very small community, so it's hard to get enough people to attend seminar or the mailing aspect of it. So I booked one about an hour away from me. I'd never been to that location. I called and I asked how many people will fit in your room. So they told me 60 people would fit in it. What I have learned is you have to ask how many strangers will fit into a room because they gave me the amount that I think if you were really teeny tiny and you were all related and you were all okay with sitting on each other's laps, you could fit in this room. So I had also been told, this was still the time, overbook your rooms and I'm sure in most demographics that is correct. But for some reason here, so I had booked 75 people to fit in this room that realistically maybe fit 40 people. It was insane. There were people standing up. It was still, right after COVID. It was in the summertime. The room was hot. The room was smelly. People were coughing in this room. And they were mad at me. They were like, why would you put this many people? I'm leaving. And I was trying to apologize and convince people to stay. And then this lady stands up and she holds up my leading response mailer and she says, you look a whole lot prettier in this photo than you do in person.
Oh, no, she didn't.
Yes. And I didn't know what to say because this was, it was an older photo of me. And so I tried to turn it into a joke like, well, maybe, what does your driver's license look like? Ha, ha, ha. Well, when she said this, the room turned to her and they were like, that was really mean of you. And they all started going, honey, you're beautiful. Don't listen to her. You be yourself. And they all spent the rest of the time supporting me, giving her mean looks. And it turned into this amazing seminar. Everyone stayed in the room, even though it was standing. And on the way out, she leaned forward and I was like, why are you even coming to talk to me? And she said, by the way, I'm in sales and I figured it'd be really better for everyone to be mad at me than be mad at you. I think you're beautiful. Isn't that hilarious? I was like, now that's the real MVP there of women supporting women.
Wow.
Yeah, it totally turned the room around to where everyone was like my little cheerleader supporting me. And I can't imagine like having a whole room hate me, but she totally stood up and turned the anger on her and helped me out.
Well, thank you, I guess. Right? How many appointments did you set from that one? Do you remember?
We booked about 50 appointments out of that one.
That night?
Yeah, that night.
Every appointment.
Person said they wanted an appointment. They were all like, we're going to support you. We're going to help you. You're beautiful. I actually wish I had found her because she did not book an appointment. And I wanted to find her so I can be like, can you do that at every event I have?
Have you come back?
Come in and be really mean to me. It was great.
So I have a rule in all my meetings. This is not a prepared question. You have no idea this is coming.
No.
That if your pets interrupt our meeting, that I want to meet them. So I see some very cute little ears in the back.
You do.
So what's the name?
That is Madison.
Hi, Madison.
Oh, she's looking at, she definitely thinks she's the queen bee of this house. We have 3 cats. I'm like, I guess, a crazy cat lady. And Madison is the silent, stoic one that kind of rules the household. Everyone does what Madison wants.
I have a cat named Samson, and I also have this L-shaped desk that I got just relatively recently. And so he gets to walk up and down my desk, and he joins the vast majority of my meetings. I didn't let him join today because otherwise he would have been a whole part, and he sticks his face in the camera. And most of my clients at this point in time know Samson. So,
yeah.
Hi, Madison.
Another one. I don't know if you can hear him in the background, but he gets very jealous when I'm talking to anyone and has to loudly sing his song in the background. So
he wants to be a part of it.
Yes, absolutely.
So you're in a very small market, as you mentioned. I remember the first time you called me and you told me what your goals were. And I go, there's no way we can do that. You told me your budget and your goals. And I go, I can't even spend your money. I would love to spend all the money that you want to spend. And I actually know that I can't do it. So we've had to get pretty creative with what your list looks like. And that's actually worked out very well for you. So we didn't just do the turning 65s. What are some of the other things that we've done in order to get you enough numbers, and how has that worked out? And why did you come up with that? Because I was interested. Some of the decisions you made, I was like, is she doing that? And then when you explained it to me, I was like, that makes sense.
Yeah, I mean, the first couple of times we talked about, like you said, you didn't think that we would have enough people. And I was determined to make this happen. I wanted to do seminars. So the first thing that I thought about was, as people get older and those med sups are getting more expensive, they may be more interested in seeing if there's other things that are interesting to them. So the first one we did, we kind of jumped really high up in age, and we targeted income people that may be just within that tight budget. And those were a lot more successful. But then we went back, and now we do not only T65, but we do up to 68 with a higher income level of people that, they love their jobs. They have great income, and they don't really want to retire until they're getting closer to 70. And that's been remarkably successful, targeting that higher income 66 to 68. We've done really well with that. And no one else is really targeting them.
Nobody is doing that. And so what you're finding with that group, those 66 to 68s that are higher income, are people who are getting ready to retire. This is what's happening. And they come to your event. They're like, I've been thinking about retiring, but I haven't quite yet. And will you please?
Yeah, it's either people that really loved their job and they had no desire to retire, or they had spouses that needed their employee income. So they had to work a little bit longer because their spouse needed 3 or 4 more years of employee insurance before they could get off and go on Medicare. So that's really, I mean, a lot of our clients have come from that kind of in-between demographic. And every one of them's been like, we were just so thankful that you reached out to us, because, they hadn't had any communication other than the commercials, and no one wants to respond to the commercials. But because they didn't transition when they were 65, they didn't know who to transition to now that they're older.
I think it's amazing and brilliant and so creative on your part, because I will tell you, yes, no one is marketing those people. Once they're out of that turning 65 window, they're not getting messages anymore unless it's like during AEP,
Right. Yeah. Yeah. And so we had to change our Medicare the flyers that you and I sent out. We had to change that a little bit to, instead of welcome to Medicare, we had to change it to Medicare 101, so that we could target both those people that were wanting to look at other options, have maybe been on Medicare for a little bit, want to see other options, to also that older demographic that were transitioning for the first time at an older range.
Really brilliant. Is there all her idea? I didn't even know what she was doing. I asked and I went with it. And I'm like, that sounds very smart. Let's go for it. And I'm so glad it's working out.
Polite on, oh, that's interesting. Can you tell me why you're choosing that?
Well, I didn't want you to do something that was going to hurt yourself, right?
Right.
That was going to negatively impact your campaign. And then when you explained it, I was like, And I'm so happy that it's worked out so well.
Yeah, it has.
Are there any other tips that you would share with someone who's thinking about doing seminars or has been doing seminars, or what has helped you be so successful at them? Something that we haven't told them yet in this conversation.
So I think some of the things that people don't necessarily think about is, when you're booking the rooms, you do want to ask, what's the room capacity for strangers versus
For real.
Yeah, I have realized that's a really big one, especially, again, I'm in a small community, so I'm using a lot of mom and pop type places. I'm not using like big famous restaurants. And being in a small community, you don't want to invite someone to a seminar and then they get there and there's no room for them. And then, maybe they're going to make a Facebook post that says something like, well, I was invited, but it was very unwelcome once I got there because there wasn't room for me. So I think making sure it's a welcoming place, you have people there to greet them. You don't just focus on the Medicare aspect. Like, be a real person that they can get to know, and make sure that you have that social media presence also on Facebook, because they're going to look you up before they come. They're going to look you up before they do business with you. And if you have no presence, or you have bad presence, that's going to affect your attendance too. And I don't know why this is something in the seminar space that people get really freaked out about, but they don't want people that have already attended a seminar or someone that's already a client to attend the seminar. I think that's the most bizarre thing, because if they're already your clients, they're going to tell everyone throughout the entire seminar, she's telling the truth. She will call you. She takes care of you. Like, you want your cheerleaders in the audience. And so if it costs you a mil, but they help you get an extra 10 clients, why is that a big deal?
I am so 100% in agreement with you with that.
Yeah.
The vast majority of my clients will send me their client lists or whatever as delete lists. Please don't invite these people.
That's so weird.
Yeah. Let them cheer you on. Let them be there and be your greatest advocate that, say the wonderful things about you that you can't really say about yourself,
Right. I mean, I think at almost every single one I've had so far, a client of mine has shown up, and they are literally like, they walk in, run up to me, give me big hugs.
Aww.
They tell everyone, she's already my agent. You guys need her. I mean, you can't pay for that kind of support. Like, you want that support there. Oh, and I would also say, and we should have mentioned this when we were talking about that older demographic, inviting them in. I have noticed that when you have the T65 and they're allowed to invite friends and family, they tend to invite their children or their husband, and it may not be someone that you can necessarily help. But when you invite that older demographic, they've already been on Medicare for a couple years. And so they are so appreciative to see a seminar. They invite people turning 65, and you actually get more people that attend. The quality of the referrals that they bring in is so much higher, because they say, I never had someone help me when I was 65. So I wanted to make sure I brought my nephew, my cousin, my neighbor, someone, so that they didn't make the same mistakes I made. So it's a different level of referrals that they bring in, different level of guests that they bring.
And I would have never expected that. How lovely that is.
Mm-hmm.
Yeah. That's wonderful. Well, thank you so much for taking some time and for sharing your success stories with us. And I am so grateful. I've loved getting to know you this past year. And I love getting to play a small role in your success story that you have. And
well, I'm
super grateful
that you've worked with me, because I know until we figured out exactly what to do, I wasn't the easiest person to work with. We had to really figure out, like, how do we fit enough people within this? And I'm just really thankful for your help.
Oh, well, thank you so much. It has been a pleasure every single step of the way.
Aw, thanks.
All right, Tabitha, have a wonderful day. Thank you.
Thanks.
We'll talk soon.
Bye.